If you're like most adults in the United States, you probably don't think about your liver very much. You might worry about your heart, your blood pressure, your blood sugar, maybe even your joints, but the liver often stays in the background, quietly doing its job. Yet this organ is absolutely central to your health. It filters your blood, processes medications, manages cholesterol, produces bile to digest fats, helps regulate hormones, stores vitamins, and plays a major role in your body's detoxification systems. When it starts to struggle, the signals are not always dramatic. In fact, early liver damage is often silent, or it shows up as small, strange changes that are easy to blame on age, dry weather, bad shoes, or a stressful week. In this video, we're going to talk about 12 unusual signs that can show up when your liver is under strain. And then we'll walk through practical, science-informed steps you can discuss with your healthcare team to support your liver. This information is for education, not for self-diagnosis. Many of the signs we'll talk about can be caused by other, more common conditions. Noticing one symptom does not mean your liver is failing. But if you recognize several of these signs, especially if you also have risk factors like extra weight around your waist, type 2 diabetes, high cholesterol, high blood pressure, or regular heavy alcohol use, it is worth having a serious conversation with your doctor. The earlier liver problems are found, the more options you usually have to slow, stop, or even partly reverse the damage. Let's start with the first unusual sign. Sign number 1. Pale or floating stool. Most of us don't want to look in the toilet any longer than we have to. But your stool can give you important clues about your liver and bile system. Under healthy conditions, your liver makes bile, a fluid that helps digest fats. That bile travels through tiny tubes called bile ducts into your intestine. And as it mixes with food and bacteria, it contributes to the typical brown color of your stool. When the liver is heavily loaded with fat, inflamed, or when bile ducts are blocked or narrowed, that flow can be reduced. The result can be stool that looks pale, grayish, clay-colored, or unusually light. You may also notice that the stool is very greasy, sticks to the bowl, or floats and is hard to flush. These changes can also be seen with gallbladder problems or issues in the pancreas. So they are not specific to liver damage, but they should never be ignored, especially if they persist over days or weeks. If you notice pale or clay-colored stools, particularly along with dark urine, yellowing of the skin or eyes, or right-sided abdominal discomfort, that's a sign to contact your doctor promptly for blood tests and possibly an ultrasound or other imaging. Sign number 2. Poor night vision. Having more trouble driving at night, needing more light to read in dim conditions, or feeling like your eyes just don't adapt to darkness the way they used to can have many causes: cataracts, macular degeneration, dry eye, diabetes, or simple aging. But your liver is also part of that story. The liver stores vitamin A and produces a protein called retinol-binding protein that helps transport vitamin A to the retina, the light-sensitive tissue at the back of your eye. When the liver is significantly damaged or its protein-making function is impaired, vitamin A handling can be affected over time. That may contribute to night vision problems or an overall sense that your vision isn't as sharp in low light. That does not mean that everyone with night vision issues has liver disease. And it does not mean you should start taking high doses of vitamin A on your own, which can actually harm the liver. But if you notice new or worsening night vision problems, the best step is to see an eye doctor and also talk with your primary care provider. A complete evaluation can look for eye conditions and also consider whether liver function tests are appropriate in your case. Sign number 3. Swelling in the feet and ankles. By evening, do your socks leave deep marks around your ankles? Do your shoes feel tighter at the end of the day than in the morning? Swelling in the lower legs, what doctors call peripheral edema, is extremely common and has many possible causes. One of them is advanced liver disease. When the liver is damaged, it may produce less albumin, a key blood protein that helps keep fluid inside your blood vessels. Lower albumin can allow fluid to leak into surrounding tissues, especially in gravity-dependent areas like the feet and ankles. You might notice puffiness around the ankles, a feeling of heaviness, or an imprint if you press your finger into the skin. Liver-related edema often appears along with other signs, such as fatigue, abdominal fullness, or, in more advanced cases, fluid in the abdomen called ascites. But leg swelling is also very common in heart disease, kidney disease, varicose veins, blood clots, certain medications, and even from long periods of standing or sitting. If you notice new, persistent, or worsening swelling, it's important not to just brush it off as getting older. Let your doctor know. They can examine you, check your blood pressure, order blood tests for kidney and liver function, and decide whether further testing is needed. Sign number 4. Yellow or white cholesterol bumps around the eyelids. Have you ever seen soft, yellowish patches or slightly raised bumps near the inner corners of the eyelids? On the upper or lower lids? These can be xanthelasma, deposits of cholesterol in the skin. By themselves, they're not dangerous, but they often signal that blood lipids are out of balance. In some people, that abnormal cholesterol pattern is part of a bigger picture that includes fatty liver disease, metabolic syndrome, or long-standing high LDL cholesterol. This doesn't mean that everyone with xanthelasma has liver damage, and it doesn't mean that removing the patches fixes the underlying problem. But if you notice these bumps, it's smart to ask your healthcare provider to check your cholesterol, triglycerides, blood sugar, and, when appropriate, liver enzymes. That quick skin sign can be a reminder to look more deeply at your metabolic and liver health as a whole. Sign number 5. A feeling of pressure or discomfort under the right rib cage. Your liver is a large organ that sits mainly under the right side of your rib cage. When it becomes enlarged, inflamed, or congested, you may feel a vague sense of fullness, pressure, or discomfort in that area. People often describe it as a dull ache, a brick under the ribs, or a tight feeling that is worse after eating a heavy meal or lying on the right side. Sometimes this sensation can radiate to the right shoulder or back. Fatty liver disease, congestion from heart problems, gallbladder issues, or even irritation of nearby nerves can all create this experience. It's important not to panic over every twinge, since gas, muscle strain, and acid reflux can also cause discomfort in that general region. But if you are aware of a consistent pattern of right upper abdominal pressure, especially if it comes along with fatigue, nausea, loss of appetite, pale stools, or dark urine, talk with your doctor. They may order liver function tests, an abdominal ultrasound, or other imaging to see what's going on structurally. Sign number 6. Easy bruising or purple-red spots on the skin. The liver is central to making several clotting factors, proteins that allow your blood to seal small injuries. When liver function is significantly reduced, your blood may not clot as efficiently, and you may notice bruises appearing from minor bumps that would not have marked you in the past. In some cases, you may see tiny red or purple spots on the skin called petechia, or slightly larger patches called purpura. These changes are not unique to liver disease. They can also be caused by low platelets, blood disorders, infections, medications like blood thinners, or vitamin deficiencies. But if you notice that you are bruising much more easily than before, if your gums bleed frequently, or if cuts take longer to stop oozing, that's a sign that deserves medical attention. Your healthcare provider can run blood work, including clotting tests and liver enzymes, to determine whether the liver is part of the problem. Sign number 7. Cracked heels and very dry, rough feet. Dry skin is extremely common, especially in older adults, in dry climates, or during winter. But deeply cracked heels that persist despite good moisturizer and comfortable shoes can sometimes appear in people with metabolic and nutritional imbalances, including those associated with chronic liver disease. The liver is involved in handling B vitamins, essential fatty acids, and fat-soluble vitamins like A and E, all of which influence skin barrier health. When the liver is stressed for a long time, nutritional status can be affected. The result may be skin that is dry, itchy, or more prone to cracking. Of course, cracked heels are far more commonly due to friction, open-backed shoes, standing for long periods, diabetes, or simple neglect. Still, if you notice stubborn heel fissures plus other signs on this list, especially fatigue, abdominal discomfort, or changes in urine or stool color, it's worth asking your doctor to look at the broader picture, including your liver and metabolic health. Sign number 8. White or swollen nails. The appearance of your fingernails and toenails can change for many reasons, from aging to trauma, fungal infections, anemia, and more. In more advanced liver disease, particularly cirrhosis, some people develop what are called Terry's nails, where much of the nail appears pale or white with a narrow pink band near the tip. Others may develop clubbing, where the fingertips and nails become more rounded and bulbous. These changes can reflect altered circulation and changes in the tiny blood vessels in the fingers. They are not early or subtle signs. They tend to show up after the liver has been struggling for quite some time, and they can also be seen in lung disease, heart disease, and other conditions. If you notice major changes in your nails, especially along with fatigue, swelling, jaundice, or other concerning symptoms, do not ignore them. They are not something to self-diagnose with internet pictures. Bring them to your doctor's attention for proper evaluation. Sign number 9. Dark urine. The color of your urine can fluctuate based on how hydrated you are, what medications you take, and what you've eaten. When you are well hydrated, urine is usually pale yellow. When you are dehydrated, it becomes darker. However, if your urine consistently looks dark yellow, amber, or even brown, and drinking more water does not lighten it, it can be a sign that a yellow pigment called bilirubin is building up in your bloodstream and being excreted by the kidneys. Normally, bilirubin from old red blood cells is processed by the liver and sent into bile, then eliminated through the stool. When the liver is inflamed, blocked, or unable to process bilirubin effectively, more of it may spill into the urine. You might also notice that your urine seems unusually foamy. Dark urine in this context is often seen together with pale stool and yellowing of the skin or eyes. If you notice this combination, you should contact your healthcare provider promptly. It can indicate hepatitis, bile duct blockage, or other liver and biliary conditions that need timely evaluation. Sign number 10. Jaundice, yellowing of the skin and eyes. Jaundice is one of the more classic signs of liver dysfunction, but it sometimes comes on gradually, and people may not notice the color change right away. Friends or family might say, "You look a little yellow," before you see it yourself. Jaundice happens when bilirubin builds up in the blood and deposits in the skin, the whites of the eyes, and mucous membranes. It can be caused by several problems. The liver cells themselves may be inflamed, as in viral or autoimmune hepatitis. Bile flow may be blocked by stones or tumors, or red blood cells may be breaking down too quickly. In the context of fatty liver disease, jaundice may appear in more advanced stages when the liver's capacity to process bilirubin is significantly impaired. Jaundice is never normal. If you or someone you love notices yellowing of the eyes or skin, especially accompanied by fatigue, dark urine, pale stools, or abdominal pain, seek medical care without delay. Sign number 11. Spider veins on the skin. Spider angiomas, often called spider veins, are small, red, spidery-looking clusters of blood vessels that can appear on the face, chest, shoulders, or arms. They have a central red spot with tiny radiating vessels, like the legs of a spider. These can appear in healthy people as well, especially in pregnancy or with sun exposure. However, when they are numerous, especially on the upper body, they can be associated with chronic liver disease and altered hormone metabolism, including elevated estrogen levels in the setting of cirrhosis. Again, 1 or 2 spider veins on the chest are not a cause for panic. But if you notice many of them, plus other signs such as redness of the palms, easy bruising, or jaundice, it is wise to raise the question with your healthcare provider. Sign number 12. Itchy skin. Persistent itching without a visible rash can be surprisingly miserable and can sometimes be a clue to liver or bile duct problems. When bile components and other substances build up in the bloodstream due to poor liver function or obstructed bile flow, they can deposit in the skin and irritate nerve endings, leading to generalized itching. People often notice it more on the arms, legs, palms, or soles, and it may be worse at night. Of course, itching can also be caused by dry skin, allergies, eczema, kidney disease, thyroid issues, or reactions to medications. But if you are experiencing ongoing itch without a clear cause, particularly if you notice yellowing of the skin or eyes, dark urine, or fatigue, talk with your doctor about checking liver and bile duct function. So, what can you do if you recognize yourself in some of these signs? Or you already know that your liver is not in perfect health? The first step is always to involve a qualified healthcare professional. Blood tests, imaging, and, in some cases, specialized testing will help identify what type of liver issue you're dealing with and how advanced it is. At the same time, there are evidence-informed lifestyle steps you can discuss with your doctor that often support liver health and overall metabolic wellness. Let's talk about 6 key strategies. Strategy 1. Build a daily routine that supports liver-friendly beverages and herbs. For many people, moderate coffee consumption is actually associated with better liver outcomes in observational studies, particularly in fatty liver disease and some forms of chronic hepatitis. Black coffee, without added sugar or heavy cream, appears to have compounds that may help reduce inflammation and support liver cells. Adding liver-friendly spices such as turmeric, ginger, or cinnamon to your diet may also be helpful as part of a broader anti-inflammatory eating pattern. You do not need to put turmeric directly into your coffee if that doesn't appeal to you. But you might enjoy it in cooking, in a warm herbal drink, or in food. Herbs like dandelion root, milk thistle, and green tea are often discussed in the context of liver support. Some early studies suggest potential benefits, but they are not magic cures, and they are not appropriate for everyone. Supplements can interact with medications and can be harmful in high doses or poor quality preparations. Always talk with your healthcare provider or a pharmacist before starting herbal products, especially if you have existing liver disease. One simple, powerful step almost everyone can take is improving hydration. Drinking enough water through the day supports circulation and kidney function, and it may help your body process waste products more efficiently. For most adults, aiming for clear or pale yellow urine is a reasonable target, unless your doctor has you on a fluid restriction for another condition. Strategy 2. Reduce highly processed fats and focus on healthier fat sources. In a typical Western diet, many people consume large amounts of industrially processed oils found in fast food, fried foods, packaged snacks, and restaurant meals. These oils are often combined with refined carbohydrates, added sugars, and excess calories, creating a high inflammatory load and promoting weight gain around the waist, insulin resistance, and fatty changes in the liver. You do not need to fear every drop of oil, and moderate use of quality plant-based oils can absolutely fit into a liver-friendly plan. The key is to limit ultra-processed foods and prioritize whole food fat sources like nuts, seeds, avocados, olives, and, if you eat animal products, fatty fish such as salmon or sardines. At home, cooking with modest amounts of extra virgin olive oil or other minimally processed oils, rather than deep frying in large batches of reused oil, can make a meaningful difference over time. If you enjoy butter or other animal fats, talk with your clinician or dietitian about how to fit them sensibly into your overall pattern, especially if you have high LDL cholesterol or heart disease risk. Strategy 3. Emphasize sulfur-rich and antioxidant-rich foods. Your liver's detoxification systems rely on a variety of nutrients, including sulfur-containing amino acids and antioxidants like glutathione. You do not need special detox teas or extreme cleanses to support these pathways. Instead, focus on whole foods that naturally deliver these building blocks. Sulfur-rich vegetables include broccoli, Brussels sprouts, cabbage, kale, cauliflower, onions, garlic, leeks, and scallions. Leafy greens like arugula, spinach, and collard greens provide additional support, along with mushrooms, herbs, and spices. Eggs, if you tolerate them and your cholesterol is under control, also contain helpful nutrients for liver function. Including at least 1 or 2 servings of these vegetables most days of the week can contribute to better metabolic health and may support your liver in managing fats and toxins. Strategy 4. Cut back on added sugars, refined starches, and sugary drinks. One of the most powerful ways to help a fatty liver is to reduce the amount of rapidly absorbed sugar and refined carbohydrate in your diet. That includes sugary sodas, sweetened teas, juices, large portions of desserts, white bread, pastries, and many snack foods. Your liver is particularly sensitive to fructose, a type of sugar found in table sugar and high fructose corn syrup. When consumed in excess, especially in liquid form, fructose can be rapidly converted into fat inside the liver. Over time, this can contribute to fatty liver disease, inflammation, and scarring. A practical approach is to gradually cut back on soda and sweetened coffee drinks, replacing them with water, sparkling water, or unsweetened tea. Limit juices and large servings of desserts to special occasions. Choose whole fruit instead of fruit juice when possible, as the fiber in whole fruit slows absorption and helps you feel full, and swap refined starches like white bread and regular pasta for higher fiber options such as whole grains, beans, and lentils, in portions appropriate for your energy needs. You don't need to be perfect, but moving your overall pattern toward fewer ultra-processed, sugar-heavy foods and more whole, minimally processed foods can significantly reduce the burden on your liver. Strategy 5. Be cautious with supplements and consider digestive support only under medical guidance. Some people with fatty liver or sluggish bile flow are told about bile salts or digestive enzyme supplements, such as products containing ox bile. In certain medically supervised situations, for example, people with specific gallbladder or pancreatic issues, targeted digestive support may be appropriate. However, these products are not one-size-fits-all, and they are not a do-it-yourself cure for liver disease. Taking bile salts or strong enzyme supplements on your own could worsen symptoms in some cases or interact with medications. Instead of starting supplements based on online advice, talk with your healthcare provider about your symptoms. If you have persistent indigestion, bloating, right upper abdominal pain, or changes in stool, your doctor can evaluate whether additional testing is needed first. If digestive support might help you, they can recommend appropriate products, doses, and timing, or refer you to a gastroenterologist or dietitian. Strategy 6. Consider time-restricted eating or intermittent fasting, if it's safe for you. Intermittent fasting, or time-restricted eating, such as eating within a 10 to 12-hour window each day and avoiding late-night snacking, has gained attention for its potential benefits on weight, insulin sensitivity, and fatty liver. For some adults, especially those with overweight or prediabetes, a carefully planned fasting routine may help reduce liver fat and improve metabolic markers. However, fasting is not safe or appropriate for everyone. If you have diabetes, take medications that can cause low blood sugar, have a history of eating disorders, are pregnant, have advanced liver disease, or have other complex medical conditions, you should not start fasting without medical supervision. A safer place to begin for many people is simply reducing late-night eating, focusing on regular, balanced meals, and avoiding constant snacking on high-sugar, high-fat foods. Your liver may benefit significantly from even modest, consistent changes like these. Finally, it's important to remember that the liver has an impressive capacity to heal, but only if we remove or reduce the sources of injury. That includes addressing alcohol use, managing weight, improving blood sugar control, treating viral hepatitis when present, and working closely with your medical team on any underlying conditions. If you saw yourself in several of the unusual signs we discussed, pale or floating stools, poor night vision, swelling in the feet and ankles, eyelid cholesterol bumps, right-sided pressure, easy bruising, cracked heels, nail changes, dark urine, yellowing of the skin or eyes, spider veins, or unexplained itching, don't panic. But don't ignore them, either. Make a list of what you've noticed, including when it started, what makes it better or worse, and any family history of liver disease. Bring that list to your healthcare provider. Ask whether checking your liver enzymes, imaging your liver, or evaluating your metabolic health would be appropriate. You deserve clear information and a plan. Your liver works for you 24 hours a day, filtering every drop of blood in your body. With the right awareness, medical support, and lifestyle changes, Many people can give this hardworking organ the support it needs to keep going strong.